Hi all. Okay, I just wanted to do a quick um, review of some research papers that I found um, that you can use as a kind of a guide for your own public health programs, especially with the evaluation piece. So this is some things that you can look for, and I found these just through Google, honestly. I'm going to do another video when using the St. Joe's Library website. I do have one, but I think it's out of date. Um, and then, but this, I mean, honestly, I just know how to phrase the words because I've been doing this for so long. But look for something like the effective interventions for alcohol prevention programs, something like that, and just Google that term, and you'll probably find something similar to this. So this was the evidence-based interventions for preventing substance use disorders in adolescents. And what I'm going to do is just skip down real quick, and I hope that my scrolling doesn't make everybody too dizzy as I do this. But essentially, I'm going to you can look at how they kind of designed the programs, the different types of program designs that you can use, that you can mimic for your own programs. And then what I'm going to kind of skip down to where we want to go to was this evidence-based prevention programs. And this is are extremely important because if you want to roll out a program, it's great if there's already a program out there that is based in evidence and they already collected the evidence, and look at this, a school-based program. So that's perfect for what, a lot of folks were looking at. And I would also recommend that you do not make your programs too big. Sometimes people talked about doing obesity prevention and they wanted to do it in the entire state. Um, that's great, but realistically, you want to have a relatively small program. So you can pick a school-based program or a workplace program, something realistic that you can get off the ground with relatively few people. So schools are a great place, and I'm going to kind of skip down a little bit again, going to where they collected the evidence. Evidence of effectiveness. So, uh, again, I don't want to go through this whole thing, but basically what they say is that separate clinical trials, um, and basically how they collected the or how they demonstrated effectiveness of of their program was essentially self-reported usage of smoking, alcohol, drugs, whatever. So they one group of teenagers, I guess, got the intervention. The other group did not get the intervention, and then they compared rates of self-reported usage of the different drugs. And what they found was that fortunately the group that did go through the program had lower rates of usage overall. So there is some bias in this program because you're relying on self-reporting. So I'll talk about that a little bit later in the semester when we talk about epidemiological studies in more detail. But whenever you're relying on self-reporting, when you're asking somebody to self-report, especially drug use or alcohol use, they might not be as completely honest as they could be. They call it recall bias because they might not recall exactly how many cigarettes they smoked or how much alcohol they drank. So um, feel free to use the exact designs for this if you're doing like an alcohol or drug prevention program. I have a couple other things that I wanted to look at. This one is a community-based asthma management program, and basically the whole this is kind of perfectly outlined. I don't think anybody's doing asthma management, but we've had people doing similar programs, and increase knowledge of asthma, improve quality of life. Quality of life is an extremely important measurement tool that is used in health research. So you can just look for quality of life surveys, and you can use quality of life surveys in your program, regardless of what it is. Because if you have a group of people and you're starting, let's say, a group exercise program for elderly people, and a great measurement tool is you at the beginning of the program you give them a quality of life survey, and then at the end of 6 weeks or 8 weeks, whatever it is, you give them another survey, and hopefully there was improvement in that quality of life survey. So quality of life is extremely important for any group. And if you can demonstrate improvement, then that's a great quantitative measurement for your program. So this was just some Hawaiian children that were doing this program, and they would explain all of the how this was being carried out through the staff and some volunteers, community health workers, and they had trainers go out and give some specialized education on asthma and different treatments. And then I'm assuming a lot of times what they also do is intervention. So I assume a lot of times what they do is for people that have asthma, they make sure they're compliant with the recommendations from the physician. And because a lot of times they end up in the hospital because they're not compliant. And then as far as the questionnaires, the evaluation, they're using questionnaires, quality of life questionnaires, asthma management education and assessment summary report used to keep track of all the patients that they visited. Visitation results were recorded, of course, and then they looked at the short and long-term impact there. Okay, again, I'm not going to read through the whole thing. You can pause this and read through this on your own. Another one. So again, another way to measure the effectiveness of your program is not just, let's say you wanted to do a nutrition program. It could be that you're trying to maybe lower the obesity rate, but another measurement tool that they use, and you see this all the time, is knowledge, attitudes, and behaviors. So the effect of some type of a public health program on the knowledge, attitudes, and behaviors of the people that are involved. So this is the effect of a school-based intervention nutrition program on the parents' knowledge, attitudes, and behaviors. And the idea is that you can read through the whole thing. Again, feel free to pause this. This is just the abstract, and I'm going to kind of skip down to the results. So again, this is self-reported unhealthy behaviors. So immediately it's subject to recall bias, but it's still important and it's still useful information, obviously. So reported unhealthy behaviors were lower at the end of 1 year and even lower at the end of year 2. Numerous factors were associated with knowledge, attitudes, and behaviors, KABs, in the parents. So that's a great statistic. That's a great quantitative measurement that you can use, KAB, knowledge, attitudes, and behaviors. So let's say you're doing something like, again, obesity prevention or nutrition, or like you're doing an obesity prevention and you're doing nutrition in the school. You can do an effectiveness of a school-based intervention on the students' knowledge, attitudes, and behaviors, and do that. And also in addition to that, include maybe a quality of life survey, something like that. And both of those could combine to make a really effective quantitative analysis. Okay, and let's see. There's a couple other things I want to look at. Again, this is if you're doing, I can't remember if anybody's doing STD prevention this semester, or teen pregnancy prevention. Something that's really important that I don't think I touched on enough is the idea of authenticity. Getting, it's a lot easier to get, your local program funded if the program is based off of something coming from the CDC rather than something that you just made up on your own. So, I kind of, when I did a concussion prevention program, I went right to the CDC because they have a great concussion prevention program. Why should I make up my own? And it's developed by physicians, the best physicians in the country. So this is, if you want to do an STD prevention program, guess what? They have all the information here. They have, if you look at this over to the right, well-designed HIV STD prevention programs can significantly reduce sexual risk behaviors among teens. So right there in your introduction, if you're doing something like this, you say, according to the CDC, a well-designed program can reduce this issue. So if you're having this type of an issue in your local community, you can roll out the CDC. I think the CDC has a program. They probably do. I'm sure you can find it up here. And essentially, your role would just be to get the school to accept and agree to go to do this. And part of the problem with this is it depends on what part of the country that you're in. Most people, I shouldn't say most people, a lot of people are, at least in my position, in the public health position, fully support, education, sex education, for the purposes of STD and HIV prevention, and teen pregnancy prevention. But there's also the abstinence only group that feels that that's the only way that they should go, with abstinence only. And then there's of course, the middle ground, which is really what I support, is offer both, offer abstinence, information, and then offer information about safe protection. And because what they found is that you really need to have education in order to prevent these conditions. So in some parts of the country, though, they're not going to want these types of programs, unfortunately. I shouldn't say unfortunately. It is what it is. It's, we talked about social factors being important in the adoption of public health programs, and cultural mindsets, and sometimes they're not always going to be interested in something like this. Obesity research. Again, I'm hoping that you're looking at these websites that I'm looking at, that I have up here. If not, you can feel free to go back. This is a great program on obesity research, and this is from the SeattleChildren's.org. And I'm going to, real quick go through this, but it's, they're conducting brain activation and satiety in children using MRIs. So satiety is the term that they use. Satiety means fullness. So and if somebody has an insatiable appetite, it means that their appetite is never full. They always have that strong appetite. So satiety means fullness. So that's a problem with obesity in triggering that satiety mechanism so that they feel full. So that's a big issue within public health research, or not public health research, but brain activation, or neurology and public health. So the NIH is very interested in that. So feel free to read through that. And then this one is, success in health, impacting families together, shift. So you could, I'm not going to click on this. Feel free to click on it on your own, check that out, and then, mimic that program as you're developing your own program, and talk about how these types of, in your introduction to your program, talk about how these types of obesity prevention programs are successful or have been successful in the past, if they're well funded and if they have good leadership, of course. Okay, so hopefully this was helpful. Take care.